What is vitamin D? Let's find out through this video.
Vitamin D, also referred to as calciferol, is a fat-soluble vitamin that is naturally present in a few foods, added to others, and available as a dietary supplement. It is also produced endogenously when ultraviolet rays from sunlight strike the skin and trigger vitamin D synthesis. Where we can find vitamin D? Check these sources. Some experts suggest approximately 30 minutes of sun exposure in between 10 a.m. and 4 p.m., either daily or at least twice a week, to sufficient vitamin D synthesis. We can find vitamin D in some foods, such as the flesh of fatty fish and fish liver oils, as the best sources. Small amounts in beef liver, egg yolks, cheese, also in mushrooms, and some fortified foods such as cow and plant milk, orange juice, yogurt, and margarine. We also can find vitamin D in dietary supplements. Vitamin D has various functions for the body, including increasing calcium absorption in the gut, maintaining serum calcium and phosphate concentrations, bone growth and remodeling, and reducing inflammation. Vitamin D recommendations for child under 1 year is 10 microgram. For age between 1 to 70 years is 15 microgram. For pregnancy and lactation woman is 15 microgram.
How about vitamin D deficiency and toxicity? Conditions resulting from prolonged vitamin D deficiency. Osteomalacia, a condition in adults of weak and softened bones that can be reversed with supplementation. Rickets, a condition in infants and children of soft bones and skeletal deformities caused by failure of bone tissue to harden.
Vitamin D toxicity most often occurs from taking supplements. It is advised to not take daily vitamin D supplements containing more than 4,000 IU unless monitored under the supervision of your doctor. Symptoms of toxicity: weight loss, anorexia, hardening of blood vessels and tissue, irregular heartbeat.
Who is included in the risk group for vitamin D deficiency?
The AAP recommends 10 microgram or 400 IU per day vitamin D supplements for exclusively and partially breastfed infants starting shortly after birth and lasting until they are weaned, and consume at least 1,000 milliliter per day vitamin D fortified formula or whole milk. Obesity does not affect the skin's capacity to synthesize vitamin D. However, greater amounts of subcutaneous fat sequester more of the vitamin. Older adults are at increased risk of developing vitamin D insufficiency, partly because the skin's ability to synthesize vitamin D declines with age. Homebound individuals, people who wear long robes, dresses, or head covering, are among the groups that are unlikely to obtain adequate amounts of vitamin D from sunlight. People with inflammatory bowel disease or other conditions that disrupt the normal digestion of fat. Because vitamin D is a fat-soluble vitamin that depends on the gut's ability to absorb dietary fat. What is the relationship between vitamin D and health? Osteoporosis is, in part, a long-term effect of calcium and/or vitamin D insufficiency, in contrast to rickets and osteomalacia, which result from vitamin D deficiency. Vitamin D helps regulate the renin-angiotensin-aldosterone system and thereby blood pressure, vascular cell growth, and inflammatory and fibrotic pathways. For these reasons, vitamin D has been linked to heart health and risk of CVD. Vitamin D is involved in various brain processes, and vitamin D receptors are present on neurons and glia in areas of the brain thought to be involved in the pathophysiology of depression. Vitamin D plays a role in glucose metabolism. The vitamin D reduced insulin resistance to a small but significant degree, especially in people taking more than 50 microgram or 2,000 IU per day who were vitamin D deficient at baseline, had good glycemic control.